Have you ever found yourself or a loved one grappling with symptomatic obstruction, hypertrophic cardiomyopathy, or HCM? If so, you're not alone. But here's a question. Have you heard about CAMZYOS? It's more than just a medication. It's a beacon of hope for those dealing with thickening of the heart muscle, which can lead to symptoms like shortness of breath, chest pain, and fainting. Curious to know more? Let's take a look at these top 10 essential facts about CAMZYOS. Hypertrophic cardiomyopathy, or HCM, is a condition where the muscles of the heart become thicker than usual. Imagine if the walls of a room suddenly got thicker, making the space inside smaller. Similarly, in HCM, the thickened heart muscle can make it harder for blood to flow out of the heart, causing symptoms like chest pain, shortness of breath, and feeling dizzy or faint. It's like trying to squeeze too much water through a narrow hose. It puts extra strain on the heart. HCM can run in families or develop over time. Treatment options include medications, lifestyle changes, and sometimes surgery. Now, let's talk about CAMZYOS. Number 1. Purpose and indication. CAMZYOS, or mavacamten, is a medication prescribed for adults suffering from symptomatic obstructive hypertrophic cardiomyopathy, or HCM. This condition is characterized by the thickening of the heart muscle, which obstructs blood flow and leads to symptoms such as shortness of breath, chest pain, and fainting. CAMZYOS aims to improve these symptoms and enhance patients' exercise capacity, allowing them to engage in more physical activities with less discomfort. Number 2. How does it work? The way CAMZYOS works is by specifically targeting the root cause of hypertrophic cardiomyopathy. It inhibits myosin, a protein in the heart muscle that, when overproduced, leads to the thickening of the heart walls. By reducing the excess myosin, CAMZYOS helps to alleviate the obstruction in the heart, thereby improving its function and reducing symptoms associated with the disease. Number 3. FDA approval. CAMZYOS has received FDA approval as the first medication that directly addresses the underlying pathology of obstructive hypertrophic cardiomyopathy. Prior to its approval, treatments for HCM primarily focused on managing symptoms rather than the disease itself. This approval marks a significant advancement in the management of HCM, offering a new option that goes beyond traditional therapies like beta blockers and calcium channel blockers. Number 4. Clinical trial results. Clinical trials for CAMZYOS have shown promising results, with a notable percentage of patients experiencing significant improvements. In one major study, 37% of participants treated with CAMZYOS reported enhanced exercise capacity and reduced symptoms compared to 17% of the placebo group. These results suggest that CAMZYOS can make a meaningful difference in the lives of patients by helping them perform daily activities with greater ease. Number 5. Heart failure risk. One of the most critical safety concerns associated with CAMZYOS is the risk of heart failure. This risk requires patients to undergo regular echocardiograms to monitor heart function before starting the medication, during dose adjustments, and periodically throughout treatment. This careful monitoring helps to ensure that any negative changes in the heart function are detected early and managed appropriately. Number 6. REMS program. Due to the serious risk of heart failure, CAMZYOS is only available through a special program known as the Risk Evaluation and Mitigation Strategy, or REMS. This program ensures that both patients and healthcare providers follow strict guidelines to use the drug safely. For example, only certified pharmacies can dispense CAMZYOS, and patients must be regularly evaluated to continue their treatment. Number 7. Interactions with other medications. Patients taking CAMZYOS must be cautious about drug interactions. Certain medications can interfere with how CAMZYOS is metabolized in the body, potentially increasing the risk of adverse effects. It is crucial for patients to inform their healthcare providers about all prescription and over-the-counter medications they are taking to avoid harmful interactions and to adjust treatment plans as necessary. Number 8. Pregnancy and birth control. CAMZYOS can pose risk to an unborn baby, so women who are pregnant or planning to become pregnant should not use this medication. Women of childbearing age need to have a negative pregnancy test before starting CAMZYOS and should use effective birth control during treatment and for at least 4 months after stopping the medication. This precaution helps to prevent potential harm to the fetus. Number 9. Not suitable for non-obstructive HCM. It is important to note that CAMZYOS is not approved for patients with non-obstructive hypertrophic cardiomyopathy. This type of HCM does not involve the same degree of obstruction in the heart, and the medication has not been shown to be effective for these patients. CAMZYOS is specifically intended for those with the obstructive form of the disease, which involves significant thickening and obstruction of the heart muscle. Number 10. Potential to reduce need for surgery. While surgery such as septal myectomy has been a standard treatment for severe cases of obstructive HCM, CAMZYOS offers a non-surgical alternative that might reduce the need for such invasive procedures. Although some patients will still require surgery, CAMZYOS may provide significant relief for others, potentially minimizing the need for surgical intervention and offering a less invasive treatment option. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.